Hello, everybody, and welcome to the Here For You podcast. I am your host, your moderator, your professional geek, Carlos Parra, and as you can tell, things are a little bit different. Recently, Dr. Moore and myself became fully vaccinated, so we thought, hey, why don't we actually meet in person and let's shoot 3 videos? And so the following videos that you're going to see on here, they were shot earlier, and then so we've been going through the process of editing, but we just wanted to present you something a little bit different, something a little more fun, and more of a conversational podcast, talking back and forth while we're just hanging out on the couch. So thank you very much. Hope you guys enjoy the videos. So today we're going to be talking about best practices. Now, we had a video before that kind of described it, but again, we want to just do a quick brief catch-up, brief summary of going, why is it being searched online? Why is it important to find an audiologist that offers best practices?
Right. So there's a list of 10 best practices that our national organizations say this is what all audiology practices should follow. And it's a way for us to make sure that we are providing the best patient care so that you as the consumer are getting the best help and the best treatment plan for your hearing needs. So we'll talk a little bit about what that means as far as being best practices.
Gotcha. Okay, so one of the first thing, right, on that best practice list, because I always look at these things going, well, wait a minute, what are the best practices, right? So we're going to break them down into a list.
Yeah.
And so the first one is developing a comprehensive treatment plan. Am I correct?
Right. That is correct.
Awesome. So what does that really entail?
Well, that means that we're going to be very specific on what are your needs? What do you need for your hearing and communication needs? So what that means is that after we've completed a comprehensive hearing test, we're going to evaluate the hearing process, determine if there's a hearing loss, determine how much hearing loss, determine the best form of treatment, and we'll do kind of what's called a communication needs assessment. So what that means is that we're going to explain those results. We're going to say, this is what you can hear, this is what you can't hear, this is what your limitations are, this is how you can get the most out of hearing treatments. And that may be hearing aids, that may be assistive devices like remote microphones, TV devices, that may mean cochlear implant assessments. So we're going to come up with what's going to be the best treatment for you, for your needs. That could mean doing a hearing aid demonstration, that could mean doing an assistive listening device demonstration, that could mean scheduling for a cochlear implant evaluation to find out if you might qualify for that. Based on that, we'll come up with this plan of what that means. If it's hearing aids, we're going to say, okay, we're going to go through a demonstration process, then we're going to go through a selection process, and ultimately we're going to have follow-up appointments where we're going to teach you how to use those devices, how to communicate with your loved ones, how to advocate for yourself when you are in a challenging environment. We're going to make sure those devices are working optimally. We'll have you come in for programming, for cleaning, making sure that you have your questions answered. If you need help setting those up on your smartphone or smart device, we're going to help you with that. So it's very personalized and very individualized for your specific needs.
So I love that. So one of the things that I look at is you are literally, it's just not just developing this strategic plan for your client, but really teaching them how to cope and learn to live with hearing loss, as opposed to, here's your hearing aids.
Right.
Thank you very much. Have a great day.
Exactly. And that's something that in my practice we don't want to be just, here's the hearing aids and good luck with them, here's the manual and see you later. You can get that online. But when you come to a professional, that's part of what you're paying for. That's part of the cost that's built in, where we're providing you with a treatment plan that's using hearing aids as a tool to help facilitate that treatment.
That is awesome. So part of the developing this comprehensive treatment plan, and you kind of touch base on it, it's going to be different for everybody.
It's going to be different for everybody. It's going to be personalized. Yeah, the majority of the time in my practice, the majority of the recommendation for treatment is most likely going to be hearing aids. Most likely hearing aids, maybe with some assistive devices. But we do work with cochlear implants as well for those individuals that need a little bit more than what hearing aids can offer. So even though hearing aids may be the most recommended form of treatment with our services, it doesn't mean that only one hearing device or one hearing aid is going to be recommended. It may be this technology is recommended for this person in this lifestyle, or this product is recommended for this lifestyle. So again, we're trying to find out the best method, the best personalized approach for each individual's hearing needs.
So we have hearing aids. So what's the difference between a hearing aid and your assisted hearing?
Assistive hearing device or assistive listening device. So there are many devices that are can help improve the effectiveness of hearing aids. So for example, hearing aids alone sometimes can't help in noisy environments as well. So if a person is really struggling in a noisy environment, like a restaurant, in a church group, or in a place where there's just a lot of noise, then they may need a little additional help, because if they're not able to process that background noise away from the speech, then a device like a remote microphone can help. So something that you can put in the center of a table that picks up that signal and streams a wireless signal to the hearing aids to make it more, to make it easier to follow that conversation. Or you can give it to someone to either talk into or clip on their lapel. So those are what we call assistive devices to help with hearing aids. Another assistive device that's very popular is a TV device. So, you know, most people love watching TV, and especially this last year when we were all homebound with COVID, we got to watching on streaming our TV programs or movies, things like that. So the TV device can be plugged into your television, again, wirelessly streamed to using a Bluetooth or similar signal to the hearing aids. And again, just allowing that nice, clear signal to come in through those programmed devices for your specific hearing loss.
That is amazing. I kind of want to just get one so when the kids are talking during the movie, I can listen to tune them out.
Absolutely, it can be fine for even when you don't have hearing loss. Right.
Oh, that's hilarious. Okay, so, and then you mentioned cochlear implant.
Yeah.
So again, this is all part of the development of this treatment plan.
Got it.
So where do you go, where do you leave off from going from hearing aids to cochlear implants? What's the difference? And really, what's the main difference of how people require those two different technologies?
Absolutely. So not everyone is obviously going to qualify for a cochlear implant. There are very specific guidelines that we have to follow when evaluating someone for a cochlear implant. So for example, they have to have a certain amount of hearing loss to qualify. They have to be able to perform a certain, I guess you might say, degree of poor word recognition in order to qualify for a cochlear implant. If someone is coming to us and they've never worn hearing aids before, they've never treated their hearing loss, and they want to talk about cochlear implant, that's probably not the first thing we're going to do. We're probably going to find out, okay, what is your hearing loss? Do you have hearing loss? What is the degree of that hearing loss? And can we first try to use amplification through hearing devices, let your brain start to figure out what all that information is, see how well you do, and then if you're still struggling and we're determined, yeah, this is the best we can do, then we can start looking at a cochlear implant evaluation. But I like people to maybe have hearing devices for at least 6 months to a year before we have that conversation. That's with someone who's never worn hearing aids before. Mm-hmm. Now, a lot of our patients that we do an evaluation for cochlear implant have worn hearing aids for many, many years, sometimes decades. And we're just at that point now where it's like the hearing aids are so limited. They're not hearing well in quiet. They're not hearing well in noise. They're not able to get the benefits even with assistive devices. They're just very limited. And that's when we say, okay, hearing aids are only going to do so much. We're at that point now where another device like a cochlear implant is going to help because it's going to bypass the broken hearing system that doesn't work anymore and sort of renew that system by stimulating the nerve, which gives you more access in the brain to recognize those sounds again. So that's when we say, now it looks like you may be a candidate for cochlear implant. Hearing aids are very limited on what they can do.
You're able to treat or attempt to treat early on with the hearing aids or
right.
the assisted hearing devices,
yeah.
And then move into the cochlear if it's required. Now, with this plan, are we looking at a particular age range, or is this open to like just every age range, especially now that people stick earbuds in their ears, and we've been doing it for the past 20 years? Or is it just strictly like, hey, this is only for 60-year-olds? How does this work now?
Absolutely not. So we always say that it, just like with any health condition, the sooner you treat it, the sooner you take care of it, that it's identified, the better you're going to do. So when you first have hearing loss, you first have trouble hearing, whether that's in your 30s or whether that's in your 50s or later, the sooner that you do something about it, the more successful you're going to be at retraining your brain to recognize those sounds again. So I always say, you know, even if you feel like you're not having a lot of difficulty right now, if you treat your hearing loss now, even if that is literally going and getting an over-the-counter device, an assistive device to help bridge that gap, that is at least a good starting point. If there's significant hearing loss, mild hearing loss, moderate hearing loss, then yes, hearing aids are definitely going to help with that, because again, you're missing those sounds. You don't realize it always how much trouble it's giving to you. Your brain is able to compensate pretty well until it's not, but you're expending a lot of extra energy to do that. So if we can get hearing aids on you sooner, that's allowing that part of the brain that was designed to help with speech and language work more efficiently. Therefore, you're going to do better. You're going to keep that understanding, that cognition, that speech recognition and communication for a longer period of time. You're going to be more successful as you successfully age too. So it's not just for older people, although the majority of our patients are going to be are older, 50s, 60s, and older. But we are starting to see 30s and 40-year-olds too.
Yeah, well, and I have to wonder too if it's more of the human denial of, well, no, it's too loud is what it is. That's why I'm not hearing properly.
Or people mumble.
People mumble,
and
yes.
People talk too fast.
Yes, they don't enunciate properly.
They don't enunciate. If they would just talk normal, if they would just talk slow, I wouldn't have a problem, right? Yeah, part of that is true, but that's not the whole thing about it. And that's right. I just listened to some research about rate of speech recently, and that as human beings, when we're younger, like when we are in our 20s and 30s, we're able to process about 160 plus words a minute. Okay, our brains are just able to do that. As we get older, as we get into our 40s, 50s, and beyond, that rate starts to slow down. And so we're not able to process quite as many words. Maybe it goes down to 150, 140, 130, okay, words a minute. But the average person speaking is speaking at a rate of 170 words a minute. So that's pretty significant.
That's quite an impact.
That's quite an impact. So if you are, as you're aging, your ability to process speech is slowing down anyway. You add hearing loss on top of that, and that's going to make it even harder. But the majority of people are speaking at a rate of 170 words a minute. No wonder people are having trouble processing what's being said.
Yes, indeed.
Absolutely.
Wow, that is amazing. I had no idea. So let's look at this development. What was it again? The developing a comprehensive treatment plan. Okay, so I come to you for the very first time, and I'm looking up best practices because I know my hearing is not that great. I'm a loud person in general, right? My voice carries, and apparently I have a tone that only my wife's grandmother can hear.
Yes,
because she can't hear anybody else but me.
Right. That is very true. She can't.
For those who don't know, she's actually a patient. But yes, and so that's why Cristi knows what she can and can't hear. But apparently, she can hear my voice, which is pretty amazing. And you know, but anyway, so I come in for the first time, and so what's part of this plan? Just kind of run me through this development plan. Do we set up a hearing test? Is that the beginning? What is the beginning of this process?
So it could be a hearing test. It's usually going to be one of two things. Sometimes we set up a hearing consultation. Okay. And so what we'll do is, a lot of times that's really for people that maybe have had a hearing test from somewhere else. They're maybe seeking a second opinion or finding out, hey, I had this hearing test done, but I don't know exactly what it means. What are my options? Okay. So we'll set up a consultation and kind of explain that result, what it means, and then what our options are. And from there, we may decide what we're going to do at that point. For someone who maybe is, like you said, kind of investigating this, well, I don't think I'm hearing so well, but I don't know what my hearing is, then we're most likely going to set up a hearing test. And from there, we're going to take a case history. So we're going to find out, where are you having trouble hearing? What are some medical conditions you have? Because some medical conditions can affect or put you at a higher risk of hearing loss as well. So if you have diabetes, you have heart disease, high blood pressure, those are all things that we want to know. Those are important things to know about because those can have an impact on your hearing too. Do you have tinnitus, ringing in the ears? Have you had noise exposure? If you had ear surgeries, ear infections as a kid or an adult. Those are all things that we want to find out during that comprehensive evaluation. Then we'll test your hearing and we'll find out how well you hear different pitches and tones, from low pitches like vowel sounds and high pitches like consonants, everything in between. And we'll do some words in quiet, see how well you can understand very basic words in a quiet environment, how well you discriminate those sounds. And we'll do some speech and noise testing as well. That really stresses your system to find out how well do you process speech when you are in a typical noisy environment. Because maybe you do fine and quiet, but you break down when you get into noise. And that's important in our counseling aspect of how we might say, okay, this is an environment that's going to be more challenging for you. So that can really help us determine, again, the best form of treatment for that person, right? And then we'll go over the results and we'll say, okay, this is what we have in front of us. This is what your hearing assessment tells us. These are some recommendations that we can do, and then we'll move forward from there.
Well, thank you so much. This is it's such an insight to see like what the difference is, how you as a professional will drill down and go, look, these are the best practices because it is what our industry has set as a standard.
It is.
And really just being able to educate your clients, be able to, and again, not just send them away, but to continue their hearing health as time goes on.
Absolutely.
So that is amazing. Thank you so much.
You're welcome. Thanks.
So everybody, again, this is part one. This is going to be the first best practices we're going to be talking about. So please like, subscribe, ring that bell for notifications when we do the second video on this subject. And again, we're just bringing more information so we can keep you educated and keep you in the know. Thank you very much, and you guys have a great day.
Thanks. Bye.